pregnancy journey is unique for everyone. For some, it happens quickly, while for others, it takes more time and intention. Knowing when to transition from just trying to seeking answers can sometimes feel confusing and fraught with emotions. Understanding the evidence-based guidelines can remove the guesswork and help you to take the next step with confidence. Hi, I'm Dr. Sylvia, a GP and health educator. Welcome to AskAwayHealth. A fertility specialist is an obstetrician or gynecologist with advanced training in diagnosing and treating infertility and complex reproductive disorders. Infertility itself is defined by major medical organizations like the World Health Organization and the American Society for Reproductive Medicine, the NHS, as the inability to achieve a clinical pregnancy after 12 months of regular unprotected sexual intercourse. And regular usually means at least 3 times a week. This 1-year rule is a standard guideline for a reason. It's based on statistics because we found that in a couple where both partners are under the age of 35, they have no health issues, about 85% of them will conceive within 1 year of trying. And so seeking help before this 12-month mark is not usually, for most people, not usually medically necessary. However, it's a general rule, and please, you should seek help sooner if there are critical factors, and I'm going to mention them in a minute. These organizations like the NHS, WHO, and other bodies, they clearly recommend that we should have an earlier evaluation after 6 months of trying, for example, for women who are age 35 or older. And this is because of a natural age-related drop in both the quantity and the quality of eggs, which speeds up when a woman gets into the mid-30s. Time becomes a more crucial factor, and so urgent or quick prompt evaluation can help to maximize the chances of a successful pregnancy. And more than that, you shouldn't wait at all if you or your partner has any known or suspected medical history that could impact fertility. And so these possible factors include: 1, having irregular or absent periods where you have cycles that are consistently shorter than 21 days or longer than 35 days. That could indicate that ovulation is not happening regularly or even at all. That's something called anovulation. Some of you may have read about that. And it's a common cause of infertility. So that's a reason not to wait 12 months or even 6 months. You may have known conditions. For example, a diagnosis of PCOS, polycystic ovarian syndrome, endometriosis, fibroids, or a history of pelvic inflammatory disease, all of which can affect fertility. Another condition is if you've had surgeries in the past. So for example, you've had surgery on the ovaries, on the tubes, or on the womb, because they may be complicated by problems that affect fertility. Another one is cancer treatment. So having had chemotherapy or radiation therapy in the past. Let's not forget male factor. So if your partner has a low sperm count, or there's a problem with movement with the sperm or other issues with the partner, infertility is a couple diagnosis. Let's remember that 1/3 of cases are due to female factors, another 1/3 to male factors, and the remaining third are combination or we don't know. Something else to think about is if you've had multiple miscarriages, so experiencing 2 or more pregnancy losses, one after the other, needs a specialist evaluation to investigate why the potential causes for the recurring miscarriages. So what can you take away from this? Your action plan should be based on your age and your circumstances. If you're under 35, then it's recommended that you try for 12 months. And if you haven't conceived in that time, schedule an appointment with your OBGYN for initial basic tests. They can start the workup and then refer you to a specialist if needed. If you are 35 or older, the standard recommendation is try for 6 months. If you don't fall pregnant, proactively seek consultation with a fertility specialist so you can have a comprehensive evaluation. Whether you are over or under 35, if you have any known risk factors, schedule a preconception consultation immediately, even before you start trying, because this allows a specialist to review your history, arrange baseline tests, and create a plan to optimize your fertility right from the start. And hopefully doing so proactively will minimize some of the emotional toll that can happen with trying to conceive. For everyone, begin taking a prenatal vitamin with at least 400 micrograms of folic acid before you start trying to prevent any neural tube defects in the baby. So knowing when to seek help is a really strong step, and many women are sometimes not very sure. And if you're not sure, please ask. These timelines are not meant to create alarm, but just to provide a clear scientific framework and help to guide decisions and treatment. Trust your instincts. Don't forget that everyone is different. And if something doesn't feel right or you're not sure, if you have a known complicating factor, please speak up and get help from your doctor. Seeing a specialist is not a sign of giving up or failure. It's a proactive, positive strategy. You want to gather information, explore your options, work out if there's anything that needs to be done sooner than later. And it's just about equipping yourself with the best possible team and the knowledge to achieve your goal of building your family. Do you want to learn more about your body? Check out this video here next. Don't forget to give this one a like and subscribe to the channel before you go off, and I'll see you over there.